All right, let's jump right in. Tuberculosis therapy. It's probably one of the most complex, long-term regimens we handle in the pharmacy, right? But getting it right is absolutely critical, not just for the patient in front of you, but for public health as a whole. So think of this as your practical playbook. Everything you need to know from the moment that prescription hits your screen to the very last refill.
So, here's how we're going to break it down. We'll start with what to do when you get that new TB script. Then we'll cover the huge difference between infection and disease. We'll decode the first-line regimens, nail down the key counseling points for the main drugs, touch on some special populations, and wrap it all up by really highlighting your crucial role in this whole process.
Okay, so picture this. You're at your station and an e-script for a multi-drug TB treatment pops up. This isn't just another antibiotic fill. No way. This is the start of a long and often difficult journey for the patient, and you're one of their most important guides.
So, what's the first thing that goes through your mind? For most of us, it probably boils down to three big things, right? First, just the sheer complexity of the regimen. We're talking multiple drugs, all with their own quirks. Second, the duration. I mean, we're talking months, not a 10-day course. And third, and this is the big one, is adherence. How in the world are we going to help this patient stick with it? Because that is the single biggest key to success.
Now, before you even start thinking about the drugs themselves, the very first question you have to answer is, what are we actually treating here? Are we dealing with an active, infectious disease, or are we trying to prevent one from ever starting? This is, without a doubt, the most fundamental distinction, and it changes everything about the treatment plan.
And this slide lays it out perfectly. On one side, you have TB infection, what we used to call latent TB. The person feels fine, they have no symptoms, and they can't spread it to anyone. The goal here is pure prevention. But on the other side, you've got active TB disease. Here, the person is sick, they have symptoms, they are infectious, and our goal is a complete and total cure. Everything you do hinges on which side of this chart your patient is on. Okay, so once you know if you're in prevention mode or cure mode, you can start to make sense of the treatment strategy. Let's take a look at the standard first-line game plans for both of these scenarios. So for preventative therapy, the good news is the regimens are a lot shorter and simpler. The two most common options you'll see are 4 months of daily rifampin or a 3-month course of isoniazid plus rifapentine, taken just once a week. Both of these are fantastic at stopping the infection from ever turning into the full-blown disease. Now, for active disease, this is where we bring out the heavy hitters. The gold standard is a regimen that lasts at least 6 months, and it's split into 2 distinct phases. First step is the intensive phase, 2 months of all 4 RIPE drugs. That's rifampin, isoniazid, pyrazinamide, and ethambutol. The whole point here is to rapidly kill off as many bacteria as possible. After that, we move to the continuation phase for 4 months, usually with just rifampin and isoniazid to wipe out any stubborn bacteria left behind. And now we get to the heart of it. This is our time to shine as pharmacists. Every single patient starting these drugs needs to understand what they're getting into. Mastering these quick, high-yield counseling points for the Big Four is, frankly, non-negotiable. It's how we keep patients safe and on track. First up, rifampin. The most famous counseling point, of course, is the orange-red body fluids. You have to tell patients their urine, sweat, and even tears might turn orange, and that it's totally harmless. Super important, warn them it can permanently stain soft contact lenses. But clinically, the most critical thing to know is that rifampin is a powerhouse enzyme inducer. That means tons of drug interactions. We're talking oral contraceptives, anticoagulants, you name it. Your med review has to be flawless. Also, tell them to take it on an empty stomach and to watch for liver issues. And I just want to pause here because this is so important. We're not talking about a minor interaction. Rifampin can literally make other essential medications stop working. So, bottom line, every single time you dispense rifampin, a brand new, thorough medication review is an absolute must. No exceptions. Next, we have isoniazid, or INH. The big thing to watch for here is peripheral neuropathy, that tingling, pins and needles feeling in their hands and feet. This is exactly why it has to be given with pyridoxine or vitamin B6. It's not for a deficiency, it's to prevent this specific side effect. So make sure they have the B6 and they know why they're taking it. And just like rifampin, INH can also be tough on the liver and works best on an empty stomach. Moving on to pyrazinamide, or PZA. This one has a different profile. The most common thing you'll hear from patients is joint pain or arthralgia. It can also bump up uric acid levels, which in some people might trigger a painful gout attack.
And you guessed it, it's number 3 on our list of drugs that can potentially cause hepatotoxicity. And finally, ethambutol. With this one, the word you need to remember is eyes. Its biggest, most serious side effect is dose-related ocular toxicity. Patients might notice blurry vision or, more specifically, have trouble telling the difference between red and green. You have to tell them any change in your vision, you call your doctor immediately. This is serious stuff, and it's why eye exams before and during treatment are so important. Look, if you remember only one thing from this entire explainer, please let it be this. Adherence is everything. It's the whole ballgame. All our fancy counseling is worthless if the patient feels better after 2 months and stops taking their meds. You have to hammer this home. Non-adherence doesn't just mean their treatment fails. It's how we create drug-resistant TB, which is a global public health nightmare.
Okay, real quick, let's touch on a couple of special patient groups where we need to have our antenna up and be extra vigilant.
For any patient who is pregnant or breastfeeding, the message is simple and direct. The danger of untreated active TB is way, way bigger than any risk from the medications. The go-to regimen is typically isoniazid, rifampin, and ethambutol, and that vitamin B6 with isoniazid is absolutely mandatory here. Also, it's reassuring to know these drugs are considered safe to take while breastfeeding. And here's a huge clinical pearl. If your patient also has HIV, or if there's any reason to suspect they might have a drug-resistant strain of TB, this is an immediate red flag. These cases are incredibly complex. The drug interactions, especially between rifampicins and antiretrovirals, are a minefield. These patients need to be managed by a specialist. Period.
So let's bring it all home and talk about your role in all this, because it is so much more than just putting pills in a bottle. You are on the front lines of one of the world's biggest public health battles. Your impact really comes down to these 5 things. 1, you make sure the dosing is perfect. 2, you are the safety net, screening for those critical interactions. 3, you're the educator, counseling on side effects. 4, you become the biggest cheerleader for adherence at every single visit. And 5, when you do all that, you are directly helping to prevent drug resistance. It's a huge responsibility.
And remember, there's no magic bullet for adherence. It has to be personal. It has to be patient-centered. For one person, it might be weekly pill boxes. For another, it's setting alarms on their phone. For someone else, it's getting a family member involved. Your job is to have that conversation, figure out their barriers, and help them find a solution that works for them. So the next time that RIPE regimen flashes on your screen, don't just see a complicated prescription. See it as an opportunity. It's a chance to empower a patient, to guide them through a tough time, and to make a massive difference. Every single refill is a vital checkpoint on the road to a cure, and you're the one standing there, ready to help.